Hello, everyone. Thank you so much for joining us today. I'm thrilled about our guest today as well as our topic. I want you to know that Dr. David Wright is in the house, so to speak. And Dr. Wright is an internal medicine physician in Memphis, Tennessee, and he has nearly 3 decades of internal medicine experience behind him. Today, I predict that you're going to hear some things that you've never heard before, maybe more than one thing. So I would like for you to comment below if you do hear something that you haven't heard before. Let's get this conversation going. Dr. Wright has committed his most recent career anyway. He's always been a life-saving physician and a life-improving physician for his patients. However, more recently, he has focused his career on understanding the science behind cardiovascular disease, on truly digging into what is it that causes heart attacks, strokes, dementia, and diabetes. Not only has he brought this information to his patients, but he's been instrumental in and passionate about bringing this information to colleagues such as myself. He's not only shared this science, but also practical tools to make other physicians, MDs, DOs, nurse practitioners, even the dental community is absolutely vital in this life-saving endeavor. And so Dr. Wright is instrumental in some of the dental study clubs, as well as educating our dental colleagues, and doesn't even stop there. Dr. Wright has embraced, as we all have, and as we know, we need the life coaches, nutritionists, dietitians, meditation specialists, etc. It takes all of us to knock the #1 killer, heart disease, off that #1 spot, if you will. So anyway, I elaborate too long. I want to let Dr. Wright speak. He has a lot of great information to share with us today. Dr. Wright, welcome, and thank you so much for being on the YouTube with us today.
Thank you so much, Gina, for this chance to touch even more lives. You're exactly right. It takes all of us to do this. It's not any one person, and it's not any one profession. It takes all of us. So I'm really excited to be a part of what you and Brad and Amy are doing.
Thank you. You know, Dr. Wright, as we go through today's video, we're going to be talking a lot about heart attack and stroke prevention, of course, dementia prevention, diabetes prevention, but the viewers are going to hear us talk about the Bell-Donine method, as we do on all of these videos. But I just want to start out by saying Dr. Bradley Bale and Dr. Amy Donine are the authors of the book, Beat the Heart Attack Gene, as well as the thought leaders in this area of heart attack and stroke prevention. They're certainly the world experts, and so we're thrilled to be here talking about this method. What started your interest in going down this path, Dr. Wright? In other words, you've always had expertise in managing the health of your patients very well, but now you're just, I would say, beyond taking a deep dive, you're totally committed to bringing these life-saving prevention techniques to your patients. So what piqued your interest in this area?
Absolutely, Gina. It really has become a passion of mine, and something I will continue to focus on for the rest of my career. And actually, Gina, my story began without me realizing it, when during my internship, my father survived his heart attack at age 52.
Wow.
And at that time, which was 1979, I knew enough as an intern to realize that Dad's chances of even surviving the heart attack were about 50-50. And if he survived it, that he had about a 50-50 chance of getting back to a normal life. Now, thankfully, medicine's come a long way in the last 30 years, and thankfully, he was in that small group of people that survived and did well after his heart attack. But seeing him go through that personalized it as I was going through my training program. Then fast forward nearly 30 years, and my son, who's in the picture on the right-hand side of the screen, at age 34 is the picture of health. And he did a test that we were doing in my office that tested his arterial age. And we found out, much to his chagrin and mine as well, that he had 57-year-old arteries at the age of 34. And he was the picture of health, doing everything right, and yet had arteries much older than he was. And of course, the truth is my dad's arteries were probably 57 years old at age 34 also. And so that was another reality check. And then above and beyond that, just in practice, the first decade or so of practice, I realized I was having patients have heart attacks despite my best efforts. I had been trained by some really great cardiologists in what to do. And for example, I had a 55-year-old patient with high cholesterol that we were managing. And yet 6 months later, he had a massive heart attack. He survived it, but he had permanent damage to his heart muscle. And then I had patients that had events, even though they looked just like my son to be the picture of health. I had a colleague who was 39 years old at the time, again, had none of the risk factors like smoking or blood pressure or cholesterol or blood sugar problems. And he came into the hospital emergency room with a massive heart attack at age 39. Fortunately, he too survived that. And he came along at a time when I was starting to get more and more interested in what else can we do. I'm glad to say that 20 years later, he's still doing great, as are so many of my other patients that have benefited from the efforts that I've made over the last 20 plus years. And thanks to people like Brad and Amy and you and other thought leaders that are bringing this science to the real world.
Dr. Wright, you bring up such a great point. For example, I think there are at least two different views from those who are listening to us today. One is the individual who says, it's just inevitable. My grandfather had a heart attack, my uncle, my aunt, whatever. I have whatever it is that you have, high cholesterol, high blood pressure, whatever is concerning you. But a lot of people feel like it's inevitable. And so try to eat healthy, try to exercise, but just like there's only so much you can do. That's one camp. The other camp says, well, we've got great technology today. We've got wonderful medications. And so I see my doctor, I get my meds, I'm as protected as I can be. And if I do have a heart attack, we're better than ever at saving people from a heart attack. But I think there's a gap there. People don't really understand. They think they're protected, yes, once they go to the hospital, but that there's not much more they can do to stay out of the hospital, that they're taking their statin maybe, or they're exercising and maybe taking false peace of mind in that. So based on what we said earlier, you have a lot to share in terms of the science behind staying away from the hospital in the first place with your first heart attack. But if you're unfortunate enough to have that first heart attack, we certainly have the science to keep you from having a second one. Would you elaborate on that for a little bit?
Absolutely. And the good news is that we really do have the science and the methods now to stop arterial disease, to stop the damage that's happening in the arteries. And whether that's a person who's already had a heart attack or a stroke, or the person that is fearful that they're headed towards that, both of those populations can be benefited by the better science and the better decisions that we can now make. And it's important for people to know that these diseases take 20 or 30 years to develop. Right. The good news is when you've got a 20 to 30 year head start on something, you've got a much better chance of being able to prevent it. Mm-hmm. And that's the message that I'd like people to hear, is that it's never too soon to find out what you can do differently, and it's never too late to find out what you can do differently.
For sure. Absolutely. So,
and I think one of the things, Gina, is that over the last 30 years that we have gotten better as a profession at preventing these diseases, but we still have a lot of work to do, don't we?
We do. Absolutely, we do. Yes. So explain to us a little bit more about, what's going on here. What is it that the individual that either thinks it's inevitable or thinks that the acute care setting is going to protect them in that situation, what information are we missing?
There's an awful lot that's being missed currently. And just to give you an idea, Gina, we do have the equivalent of 3 jumbo jets full of people every day that are dying from these diseases of cardiovascular disease. Just in my county here in Memphis, Tennessee alone, 3 people every day die suddenly of these diseases. And medicine has advanced, and in the course of my career, we have reduced the risk for these diseases by 30%. But to your point, 70% of people are still having their heart attacks and strokes because something is going on. And that's what patients need to know more about, is what else is going on and what can I do about that? But just as the viewer is listening to us talk, I want them to think about whether or not they're on one of those jumbo jets right now that might be carrying them towards a heart attack or a stroke or even things like dementia. So think about that, and you don't have to stay on that airplane. But in terms of what's going on, we know that doctors are trained in managing and detecting diseases. We haven't been trained in creating health and guiding people towards health. And so really the healthcare system is very much a wait for sickness and then treat it. But patients would really like optimal health. And that's where they prevent sickness from ever arising in the first place. And so optimal health is something that takes a provider who's been trained in creating health. And not all doctors have been trained in that. Not all dentists have been trained in that. Mm-hmm. And that's what we'll talk about today. Additionally, we know that the disease starts in our arteries. And in fact, Thomas Sydenham, nearly 400 years ago, made this statement, that a man is as old as his arteries. Well, that's exactly right. And that's what we found out in my son at age 34, is that he had these 57-year-old arteries. And the good news about his story is that once we discovered that, we were able to initiate a game plan. And within a year, he had taken nearly a decade of aging away from his arteries. His arteries were actually getting younger and healthier. And so finding out your artery age with a very simple test that uses an ultrasound to look at the arteries in the neck is a way of finding out more about how am I doing? How is my arterial health, which is reflective of the health of the rest of your body. To that point, we have 60,000 miles of artery. And wherever arteries go, they're keeping organs alive, those vital organs, the brain, the heart, the kidneys. Every part of our body needs these healthy arteries. And so knowing the status of those arteries is critical. And what people also need to know is that what damages arteries is something called inflammation. That's been well established and increasingly established over the last 30 years. And in fact, not only heart attacks and strokes, but diabetes and dementia and cancer. In fact, most chronic illnesses are related to the presence of inflammation in the body. The standard tests that get done in a doctor's office don't even look at inflammation. And it's because we just haven't been trained in how to detect that before somebody gets ill. If somebody has rheumatoid arthritis, we have plenty of tests to tell us how much inflammation that arthritis patient has. Or somebody with lupus or a whole host of other diseases. But we've not been trained to do this testing in people that feel fine. So looking at inflammation is one of the things that has to be looked at. And then diabetes is a condition that takes 20 years or more to develop. And in fact, most people with arterial disease have been in one stage or another of becoming diabetic for the past 20 years. And again, if we have a head start on detecting that somebody's headed towards a condition like diabetes, then we can actually prevent that from happening. But diabetes isn't just bad because you have to take insulin shots. People that are becoming diabetic are damaging their arteries long before their blood sugar says that they've got a problem. And the cool thing is there's a real simple test that's been around for more than 60 years that can tell patients whether or not they're headed towards diabetes. But most doctors haven't been trained to use this test to detect the early stages of diabetes. Rather, they've been trained to use this test to diagnose the presence of diabetes. So we've got tests that have been around for a very long time that just need to be used in a different way. And then finally, I'm sure everybody's heard about the importance of genetics. And we now have a handful of genetics tests that really are actionable to detect both the risk for disease and strategies for reducing that risk. And everybody's genetics are different. My son, in fact, found out that he had some genetic traits that undoubtedly were in our family tree. And once we found out about them, then we were able to take action. So genetics are predictive, but they're not destiny. And in fact, they can help to guide treatment so that you can change your genetic destiny. And then probably the last thing, and this ties into genetics, is that not all cholesterol tests are equally important and equally valid at finding people that are at risk and making changes in treatment plans. And there's a type of cholesterol that's inherited by 1 in 3 Americans that doesn't even show up on the traditional cholesterol test. And so that's yet another test that patients aren't getting that can help them to identify, am I at risk? And if so, why am I at risk?
Fantastic. So if I get these tests, or if those listeners seek out a Bell-Doning method provider that's trained in offering these tests and helping them understand their true risk, the next question we often get is, what can I do about it anyway? What would be different about this approach once I identify these problems that's different than what I may already be doing?
That's a great question. And I like to go to Thomas Edison and a quote that he made nearly 100 years ago. And his comment was that the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the causes and prevention of disease. And so he was absolutely a visionary in more ways than just the light bulb and movie pictures and so on and so forth. He really understood how the human body was put together, and that, yes, we can make different choices to help guide our health. Well, this is an area, again, where most doctors haven't been trained. We were trained in disease, but not necessarily in the creation of health. And the great news is, with the right tests and with a provider that's been trained in making the right decisions that help you to change your health destiny, you really can alter the course of your life and your health. So, for example, we know that lifestyle choices are absolutely foundational. But there are different lifestyle choices for every person. I usually tell my patients, I can really try to out-prescribe your lifestyle choices, but I can't succeed in doing that. I simply can't out-prescribe the choices that you make every day. So best choices of food. Food can be medicine. The best choices for activity. Movement is definitely medicine. The best choices for sleep and stress management. And of course, everybody knows that nicotine is harmful. And so even the e-cigarettes that are out there and vaping is very harmful. But it's more than just helping people understand what their risks are, but giving them a game plan and helping them design a game plan that's right for them and that's doable by the patient. So it starts with lifestyle. In terms of lifestyle, the other thing that most patients aren't aware of is a habit that you ought to have a couple or 3 times a day is that of taking care of your oral health. So whether it be brushing your teeth or flossing your teeth, in addition to the checkups every 6 months at your dental office, that's another critical lifestyle choice. And what's not known by most providers, be they doctors or otherwise, is the vital importance of oral health to maintaining the health of our arteries. It turns out that inflammation in the mouth goes in throughout the body as well because the mouth is full of blood vessels. And so these bacteria that can get down in the tiny crevices and live and cause inflammation without a patient even knowing about it. They don't necessarily have painful teeth or bleeding gums, and yet they've got these harmful bacteria that are down inside of their mouth and at the base of their teeth. And so oral care is vital, and testing to find out if you have some of the bacteria that can contribute not only to dental problems, but also to arterial health problems is a critical part of the lifestyle choices to make as well. Beyond lifestyle, certain supplements can be critical. And so there are lots of supplements out there. But from a prevention standpoint, there's really only a handful that have been proven to reduce the risk for things like diabetes and heart attack and stroke. And so a provider that's been trained in this strategy can help a patient decide which supplements, what doses are appropriate for them. We certainly don't recommend all supplements for everybody. Similarly, there's not one nutritional plan that works for everybody. There's not one exercise plan that works for everybody. And so providers that are trained in this methodology are designed to pick the exactly right prescription for each patient. And speaking of prescriptions, I've saved that one for last. What we need to do is pick the right reason for the right drug at the right dosage. So you brought up a good point. Aren't statins helpful? Yes, they are helpful. But it turns out that not all statins are created equally. And in fact, some statins actually increase the risk for things like diabetes. Other statins have not even been proven to help women, and yet they can be prescribed for women. There's a genetic test that can help to decide what's the best statin for a patient. So by using better science, we can make better choices for some of these wonderful prescriptions that are available. But just as not all statins are made equally, not all blood pressure medicines are made equally. And not all diabetes type drugs are created equally in terms of their benefit on reducing a patient's risk for heart attack and stroke. So linking arms with a healthcare provider that's been trained in something like the Bale-Dineen method, which is a method that takes this science and takes what's known about what solutions should be applied to that specific patient. That's the critical point. And finding a provider that's been trained in creating health rather than a provider that has only been trained in treating disease once it's established. I think that's the critical need.
I totally agree. And I love the way that you've presented this information. Not only would it behoove us to seek out a healthcare provider that understands how to create health, but I love that you've focused on this precision medicine piece. In other words, kind of gone are the days of treating everyone according to what we know works in 70% of the population, because that's what the studies show. But instead, we're looking at the one individual in front of us and their DNA and determining all of the variables that can impact one's lifestyle or can impact the genetics based on your lifestyle, supplements, medications, etc. So what's right for you may not necessarily be what's right for 70% of the population, like some of the studies show. So it really is precise, and it is that epigenetics component in changing your environment to head your life in the right direction away from those genes that could manifest themselves, if you will, and harm you. So with this information and linking arms, as you have said, with a provider trained in these techniques, it is possible to bulletproof yourself from the #1 killer. Bulletproof is a kind of a trendy term these days, and certainly I'm not a big fan of guns, but it does get the point across that small things can be incredibly dangerous and deadly, and you can protect your life, your health from these small things occurring in the arteries that can take you out, or can, perhaps worse, disable you for the rest of your life. So we do have control over that, and we truly can markedly reduce our risk of heading down that path of heart attack, stroke, diabetes, dementia, and chronic diseases. So we live in an era where, as Abraham Lincoln said, that it's not necessarily the number of years in your life, but the life in your years. So I think with the concepts that you presented us today, we can have hope for both, that we aren't prematurely dying, but that right up to the last breath, we're just as vibrant as we can be, ageless, if you will.
Absolutely. That's so well said, Gina. It really is possible. Again, for people that are currently healthy and just wondering, am I at risk? Yes, absolutely. You should take that next step. Get some lab tests. Find a provider that can work with you. But even if you've already had a heart attack or a stroke, or you've had a stent, absolutely, you too are candidates for making yourself bulletproof. You don't have to have that next stent. You don't have to have that next heart attack. You don't have to have that next stroke. So we invite you to find and link arms with a provider that's trained and has your specific game plan in mind when he sits down and talks to you with your results.
Absolutely. And that information is in the text below. So please call or email today to find someone trained in these tests and techniques that Dr. Wright has presented to us today. And when you call or email us, or if you're commenting below, let us know what you heard in this video that you hadn't heard before. Let us know your questions. And I'd just like to close by saying, Dr. Wright, thank you so much. Thank you for the information. Thank you for being a leader in this area. Words that come to mind when I think of Dr. Wright, from your patients and your colleagues and really all that know you, are things like beloved and esteemed and respected. And I just can't say enough about how thankful we are that you took the time today to share this information with us.
You're so welcome. Thank you, Gina.